It's Wednesday night, and we're live from Oakdale, Washington, in the Educated Touch studio. Welcome to Ethics Outside the Box, with your host, Nathan Nordstrom. Special guests include... and you. Here he is, Nathan Nordstrom.
Hello, everyone. It's great to have you joining us today. We are having fun with ethics. Ryan Hoyme, aka Massage Nerd, is joining me today as we talk about ethics. And we're going to be talking about ethics in a couple of different twisty ways. But we always want to connect with you on Facebook Live. Let's see if I have everything set up so I can see your comments. If I don't, I bet Ryan is smart enough to have it set up so that he can really connect and listen. I see, oh, aloha from Daniel. Thanks, Dan. All right, so we are live on Facebook and we're connected to YouTube. We're going to be talking ethics. We're going to talk about Standard 6 specifically. And we're going to start playing really the game of what is all wonderful about having a wonderful ethical experience, both as a massage client as well as a massage therapist, and making sure you're ethical and why you would want to do that. Done. Moving on, we are going to go to that same place where we always go to remind you how we get to our ethical standards and kind of making sure that we have the standards set up. Facebook is not where we use our ethics standards or choose to define our ethics by. However, you should be ethical on Facebook as well, FYI. However, we're going to be talking about Standard 6, D, E, and F. So before we get to what D, E, and F is, the place to go is www.ncbtmb.org. And then at the very bottom of every page, you'll find Standards of Practice. And these are the standards that really connect with what it means to be a massage therapist, how you organize yourself and make sure that you're following standards that are safe and professional. So with that, I'm going to go backwards on this one because I can. And we're going to go with Standard 6F first, because that's kind of where I hear Ryan and I have the most knowledge. We're going to read through these, and then we're going to kind of introduce Ryan a little bit here. So only perform therapeutic treatment in the oral cavity as indicated in a plan of care after receiving informed voluntary written consent, and only if the certificant is permitted to do so under state law. So that's working in the mouth. It is a orifice of the body, and that's something you have to be conscious and safe with. But let's go to E. So back up one. Only perform therapeutic treatment beyond the normal narrowing of the ear canal and normal narrowing of the nasal passage as indicated in a plan of care after receiving informed voluntary written consent, and only if the certificant is permitted to do so under state law. Now we're going to go back to D and say, don't touch the genitals. No genitalia touching.
Never.
Period. And they really should have a period there. It's a semicolon. But nonetheless, that's a pretty blatant statement that we really want to connect with. So that's kind of what we're going to be playing with, how we're going to be talking, what we're going to be talking about. Let me introduce my guest today. Ryan's been on the show twice before, and I really appreciate it every time we get together because, A, he laughs at my jokes. I don't know why.
At you.
He laughs at his jokes. And he really has some really great concepts, really great ideas, and he's been one of my motivating people for doing this show this year and several other things. My guest is Ryan Hoyme. Ryan, thank you for joining me.
Thanks for having me.
I kind of want to have the applause audience. Yeah, Ryan! in the background.
Round of applause.
I think I'll mic that in later. But Ryan, we contacted each other early on in the year, and we've talked. And what's going on with you? Are you out doing massage? Are you doing any teaching? Are you running around? Are you staying at home? What is your deal?
Currently working at a hospital now as a massage therapist. So I've been there for about 2.5 years and loving every minute of it. So, and that was my dream job 21 years ago when I entered the massage profession. So it finally happened. So never give up on your dreams. Yep.
Yeah. Well, when the dream hits, it really becomes a great experience to live your dream and understand those pieces. Now, I understand that's what you're doing, but you're also doing other things. Didn't you just finish a degree?
I'm in the process. So next year I'll finish a bachelor's then. So.
Woo!
Yeah.
Awesome.
Yeah, because many times in the past I started and just didn't finish, but now it's the time to finish it. So I'm getting older, but you're just never too late to finish a degree because they can never take education away from you. That's the nice thing about it.
No. Now, you also have a daughter that's in high school or getting ready for college or just started college?
Yeah, she's a junior in high school right now, so that's a scary time for any parent. So
you have to get your degree done before she gets hers done.
Yeah.
That
Deal. Yeah.
Checkmate. Awesome. All right. Now, are you also doing respiratory?
Yeah. Certified rhythm analysis technician. So I monitor telemetry at Mayo Clinic then too.
Does that help you when you're assessing in massage? Anything that you do there, do you kind of parallel in the massage world?
Not necessarily, but it's so nice. But it's so nice when I go into patient's room, I can actually see their monitor if they're hooked up to a heart monitor. So I can see what kind of rhythm they're in and if massage is actually lowering it or changing it and stuff. So it's pretty cool.
I have a friend who's doing a little bit of research. She got donated some heart monitors from one of the heart monitor companies. And she's doing something that's pretty much the opposite of what you just talked about. She's wanting the massage therapist to strap on these heart rate monitors while they're giving massage.
What?
To see if the act of giving massage increases, decreases your heart rate, really kind of recognize the calories that are burnt, all of those types of things, to see what the health of a massage professional is in their daily work schedule. It's bizarre, it's weird, it's different, but it's something that hasn't been studied. And so it's really kind of nice to kind of see where we can connect with massage therapists who are overweight, underweight, massage therapists who are older, who are younger, massage therapists who are advanced in the profession, and massage therapists who are new in the profession. All these things are really kind of coming together to kind of really just right now collect data. And then once the data is collected, we can start simulating what that actually means. But it's just so exciting to see that not only does your client's heart rate change, but as a professional, does your heart rate change when you're in your peak performance, when you're in that Zen place as a massage therapist? It's something that I find exciting. We'll see if that actually goes through and everything is awesome or not. But
definitely let me know when it comes out then. So I would love to know that.
Oh yeah. No, that's our geekdom for sure. So also, Ryan, you just finished up something else, which is not a degree, but is as good as delivering a child, from what I hear. And that is publishing a book called The Complete Guide to Modern Massage. Yes. I have some questions for you about this book. And first of all, I'm going to warn you, I have not read the entire book. I have it and I will, but right now I haven't gotten to that yet. But I went through a couple of things because I was really intrigued, because for the last 9 years I've been working on a book, like a page a year. But My publisher hates me. It's a real bad system. But one thing that I really got into was, who is my audience? And one thing that when I looked at your book, I was like, okay, there's multiple audiences here in my mind. When you were writing the book, who were you writing it for? What was the connection that you were trying to go for?
I tried to gear it more towards the public as much as possible, or maybe a massage student as much as I could, just because there's more of a market out there, and I wanted to educate the public as much as possible about massage, because
Awesome.
there's sometimes not so good information out there too. So I even share my story about how I got involved in massage, give many different kind of techniques, explain a little bit about different massage styles out there. So just enough for people to start asking questions, especially if they're going to go get a massage from a massage therapist. So I read this somewhere about, let's say, shiatsu, and so you perform this, and show me a little techniques, or can you explain a little bit more about this then? So I want the clients to engage in conversations as much as possible.
Well, one of the things that I saw in the book was that it's very much a self-massage, learn how to do certain things, just like a tasting of different pieces, of different concepts. And I really enjoyed that.
Yep.
I liked that there are pictures of how to do different strokes and how to do different things and what different things you have as a possibility. It's a really easy, basic user's guide in my mind that it isn't just feeding to that audience, but also feeding to the audience that the massage profession really needs right now. And that is more massage therapists, more licensed massage therapists to practice. Because if someone picks up your book and looks at it and goes, oh yeah, no, I've been doing this type of stuff my whole life and I'm excited about it, then they can go, oh, wait a second, maybe I want to be a massage therapist. And all of the massage schools are pushing for this, saying, we don't have enough massage therapy students to graduate and to fill our spas. We have markets that are booming who are filling our hours, but we just need more massage therapists to fill the rooms so that we can have more clients come in. I really appreciate that one piece, because that's kind of the longevity of what massage therapy is going to be, is going to require that we have qualified, trained massage therapists.
Yep, and with my publisher too, they kept giving me recommendations because I kept going too advanced, and they kept telling scale it down a little bit. You know, so that was the hardest thing for me to do, and I wrote that whole book in 2 months too. So
I'm not frozen here. I'm just stunned.
But luckily I taught for many years too, so I was able to pull from my notes and things like that. But
that's bull. I mean, yes, you have years of experience, but 2 months of So in 2 months, what else were you doing during those 2 months? Did you like stop your jobs and just sit? Okay, you're nuts, man.
It's called OCD. That's what I have. So I got to keep busy 24/7. So
170 pages in 2 months. Well done.
Yep.
I can't say enough how amazing that is. Yeah, so that is definitely an impressive feat. Congratulations to you for doing that. Really quick, Nate and Ryan, Hoimi, Colette Wilson loves you. Happy holidays. Exclamation points, not periods. That means something. But I don't remember what. So we're moving on. Thanks, Dan. All right. So
in the ethics part, they wanted they think it should be exclamation points instead of periods instead of the colon and stuff. So.
Oh yeah. Absolutely. Well, we're going to talk about ethics and other stuff. So all right. So here we're going to. I'm assuming in this book you don't get into the concepts of intraoral massage, intranasal massage, inner ear massage, interanal, intervaginal, any orifice of the body.
Not at all. No.
Not at all. It's not something that I think the general public ever wants to really think about unless it's with their doctor, and they're not even wanting that. They're afraid of that.
Right.
Yeah. Okay. So when we're starting to talk about this, were you ever trained in any of those techniques?
Intraoral, and then also some with the nasal too, so MFR technique. So I've noticed huge benefit with the nasal technique, that it actually helps drain, and usually after a minute or two, they start tasting in the back of their throat, but I warned them beforehand, so.
Hey, you're going to taste something nasty here in just a minute. Is that the go-to, or is it, here's what's going to happen? I want you to be aware, are you okay with that?
Yeah.
Have them sign off saying, yes, I'm okay with nasty tastes. I mean,
Yeah.
to me, when I was in massage school, that's where I learned intraoral, and it was a myofascial release class. And we went through and we were talking about the effects of intraoral work and kind of working with the skull and kind of the fascial system and how it's stabilized. And in school, I noticed one thing right off the bat. It hurt like a son of a gun. My pterygoids were so tight and all of my jaw was just so locked up, and I didn't understand why. And so when I started then doing it later on myself, I realized how much benefit it gave not only my jaw, but my head, my neck, my shoulders. It did a lot of stabilization. And so there is absolutely a benefit to working these different orifices of the head. But I love the two major things that it says on here, which I'm going to reshare here in just a second after I probably hit Facebook on accident and then go back to the standards. There's some key aspects to this. Only perform therapeutic treatment in the oral cavity or the nasal or in instruction of the plan of care. So there has to be a plan of care where there's a focus on why. You don't just decide, hey, you know what, I'm going to stick my finger up here, or I'm going to touch this and see if it helps. You can't have exploratory intraoral work. It is a planned, organized structure. You don't just get to jab there and say, okay, did that help at all? You have to have a plan of care. Just a plan of action, an action plan there. After receiving informed, voluntary written consent. Written consent, I think, is underestimated in our massage profession, but it is so important when we're truly looking at what is written consent and how do we get it. When you at the hospital, I'm assuming you guys have a written consent form, but you have that as a hospital. Do you have a separate massage therapy written consent form in a hospital?
For outpatient, we do, yes.
Okay.
Yep.
But inpatient, it's going by the same protocol, or?
Yeah, same protocols and everything that nurses and the doctors and everybody else goes by, yep.
Awesome. Okay, so in outcall, is there anything that in your official form that you thought was super important when you came out of massage school, or now that you've been in practice for a while?
Definitely past surgeries or ailments or pathologies are the biggest things that I always look for. And even if they don't mark anything, I usually can get something out of them.
Everyone forgets about that major quadruple bypass surgery that they had 6 months ago. You have those things that just slip people's mind, but then you have those things that people don't think really will affect their massage. And I know that they're not intentionally trying to be mean and cruel to their massage therapist, but they don't recognize that we have to change our protocol due to their current condition or their current state. Just last week, so on my last episode, I came across a state or a city's ordinance that they just organized. And in the city ordinance, it says if anyone has a fungal infection, they can't get massage. And I was like, athlete's foot is a fungal infection. So because they have athlete's foot, you cannot massage their neck, shoulders, and head. Because it didn't give any exception or abbreviation or limitation. It just said, if they have a infection, a fungal infection, you can't touch them. You need to send them to a doctor, and they need to see the doctor. And then once it's cleared up, they can come to you. I was like, oh, there's a lot more in that we're just not going to talk about because we talked about it last week. But it's interesting to see what bureaucrats will put down on paper to keep people safe from massage therapy if they don't ask massage therapists their experience and what is really safe protocols for massage therapists and what we do. Is there any reason in your mind why someone shouldn't do intraoral, intranasal work?
Well, definitely for nasal, if they have a severe infection, a lot, and especially working in the hospital too, for inpatient, we can look at their charts and really see what's going on, because I always have to get permission from the nurses or doctors in order to massage the patients. So a lot of times they'll say, okay, but once in a great while, I'll look through the chart just to make sure, and I'll find something that, yeah, probably not a good idea then. So
you've seen opportunities, and I've seen this as well, where a doctor will say, yeah, sure, go ahead and get a massage, it'll be fine.
Yeah.
And you look at them, you're talking to them, you're just kind of checking off the mental boxes and go, wait, yeah, we shouldn't do a massage on you today.
Yep. And it's nothing against the healthcare professional. I mean, they're skilled in one area kind of thing, but we have a different kind of skill, and you just never know. Maybe 5-10 years down the road, maybe it's totally okay. But for right now, the education, the research that we have for us, we're saying no for certain things. So
now, in my professional experience right now, I'm having a lot of conversations with spa owners, and spa owners are always concerned about two different sides of massage therapist assessment. One is that the massage therapist is going to under-assess them and hurt someone. Or the other side, they're going to over-assess them and say that they can't work on someone when they really could work on someone and it would be okay, but the massage therapist doesn't feel comfortable doing that work. Mm-hmm. And I always go back to that spa owner and say, you know what? That massage therapist isn't comfortable doing that. Support that massage therapist. Now, unless they're weeding out like 70% of the possible clientele. I don't work on women. I don't work on children. I don't work on men over the age of 40 or men under the age of 30. You got a real niche market there, and a spa owner probably won't deal with that. But if someone's concerned about a health condition, as the massage therapist, I always want to aid on the side of that massage therapist has been trained to do what they know how to do. And if they're uncomfortable, you should support that massage therapist no matter what office, what level or location they tend to work in. You're working in a hospital. You're going to work on things that I will never work on. At least my assumption there.
Yeah.
Have you worked on people who are diagnosed in pretty gnarly situations?
Yeah, but luckily the hospital that I work in, they don't take the severe cases. So,
okay. Well, that helps.
Like the big gigantic hospital, yeah, they'll have everything possible kind of thing. So, I mean, it's a smaller rural hospital, so it's around 30 bed. So it's a little bit smaller, and they only have like four beds for specialty care units. So it's only that area too. So
that really does open up a lot of possibility for what the healthcare system can do together, as long as they're working together and connecting. I regularly see kind of the multi-conglomerate super hospital that has everything in it and has all the different wings, and then they take a massage and they say, okay, go work with people. And now the massage therapists are like, okay, let me work on the nurses first, and let's see if we can get that going. And they get that going, and all the nurses love them. And then they get an adventurous massage therapist who's like, you know what? Let's see what the cardiovascular center needs for massage therapy. And they step out and they step into these other pieces where sometimes it's going to be safe and wonderful, and sometimes it could be leery and there could be concern. I love how research is starting to come out more and more and more that really demonstrates the value of massage if it's done correctly.
Yep. And what I had to do too when I first started, I didn't have a lot of referrals for massage for inpatient. So I did give the nurses and doctors quick little massages to educate them more about massage. And that helped out huge. So after a few months of doing that, I started getting booked on a regular basis. So
that's awesome. And so how does the referral system kind of work in the hospital? Is it always by the doctor, the nurse, or do you have patients who came in who now their spouse is in and they're saying, hey, you know what, this Ryan guy, he's pretty awesome. You should have him come give you a massage.
So the nurses are the main ones that have to give the referral. Doctors can too. A lot of times doctors aren't around as much, but the nurses are always there with them. But sometimes there's a patient that comes back on a regular basis, so they know that I'm there. So then they'll ask the nurse, can you put it in referral, an order for massage? Or if a spouse too, they'll do it that way too. But they always have to get permission from the nurse too before I massage them. And I love that. I love that idea. Nurses are there all the time with them. They know what's going on and stuff. And I'm just there for a little snapshot. Is basically what it is. But I do always like to read over the charts before I actually go into the person's room too. So,
did I ever tell you my hospital story?
I don't think so.
I worked in a hospital once. I got. Because of my connections with AMTA, I was in Oregon, had a Washington State massage therapist who I knew who was a volunteer for AMTA up there, call me up and say, hey, I have a client who's down at the university hospital in Portland. I'm not licensed in Oregon. Would you be willing to go work on him? And I'm like, I don't know what's going on. He says, he broke his neck. And I went, I don't think that's going to help. And she said, no, let me have the wife give you a call and we'll talk about it. Well, he had been in a motorcycle or a dirt bike track, jumping his dirt bike and doing all these adventurous fun things. And he ended up landing on his neck and breaking it. Went to the hospital. They put in 2 poles in his neck and kind of really put his vertebrae back together. His spinal cord was actually fine. It did not interrupt the spinal cord at all. However, his vocal cords were paralyzed because one half of the vertebrae went forward. And the other challenge was that he had part of the hip bone taken out to kind of really settle the area. And he was having excruciating pain. And he couldn't get past the pain. And so his wife said, I know what helps him with pain. It's massage therapy. And the hospital said, we don't have anyone to come out to the hospital. And so she says, well, I'm going to call someone. And she called her massage therapist who called me. I talked to the wife and I went into the hospital. My first thing was, okay, hi, I'm Nathan. I'm a massage therapist. The nurses looked at me like I was a moron. And I said, well, here's my massage license for the state of Oregon, and here's my professional liability coverage. If you want to keep it, you probably should. Just kind of keep it in the file. But I keep a copy on me, so if you ever need it. So I went into the patient, and the first thing was the doctor said, I'm not sharing any of my documentation with you. And I said, well, that's going to make this a little dicey and a little challenging. So the wife said, well, you can share it with me, right? And he said, well, yeah. She says, give it to me. And she handed it to me. The doctor gave me a good solid evil eye. And I'm like, okay, so he's on this much morphine. That seems like a lot. He's like, yeah, that's the max that he should be on. He can't be on anymore. That's why that looks like a lot. Okay. And I'm going down and pretending like I know what I'm talking about and seeing I knew some stuff. I knew the vertebrae. I knew what was going on. I knew the hip. I knew the surgery. And so I was like, okay, well, I don't know, but here's what I'm going to do. I'd love to just start with giving you a foot massage. Would that be okay? And the doctor's like, do whatever. It's good as praying. And I was like, oh, okay. Well, placebo effect. Yes. And so I went down and started giving him a foot massage. And you could visually just kind of see him go from hyper tense with the halo on, obviously he still has the gear on, to just kind of letting his body reduce in tension and started breathing in a deeper way. And so that was actually when I was teaching in massage school at night. And so I got done with the massage and then drove down to the school. By the time I got done teaching that 4-hour class, I got a phone call from the wife saying, "Will you come back tomorrow?" And I'm like, sure. Am I going to be chased off by the doctor or the nurses? She's like, "No, because I'm going to guard you." Like, okay. So I went up and I did the second day, and I worked on his legs all the way up to, well, his greater trochanter. I didn't go up to the ilium, but got his legs to start moving a little bit more. And he had a little board because his vocal cords were still paralyzed that said, "This feels great. This is making the pain go away." And so at the end of the night, I said, "So why did I get a phone call?" She said, "Because it was the first time that he denied his pain medication since he had been in there."
Oh.
He actually finally felt like he could relax and have things really start to settle. That moment to me was like, oh, this is awesome. This actually does stuff. And it really kind of worked my brain around the sympathetic and the parasympathetic, fight and flight. You're in the hospital. You don't know what's going on. You're afraid. Your neck was broken, and so you think you're dead, but you're not dead. But all of that stuff kind of settled. In, I think it was 4 days of seeing him back to back, he went from maximum pain medication in the hospital to going home.
Oh.
And I mean, he had obviously had the surgery already settled and that kind of stuff. But yeah, the 4th day he went in for his doctor's checkup, and they released him and said, "Yeah, go home and see your general practitioner up in Washington." You know, those types of things to me really make a huge impact, because you not only see the massage therapist, but you see the doctor, and the doctor gets a different perspective. And when you hold true to ethical standards like the standard of practice for NCB, and you start talking about, you know what, you have boundaries, and my boundaries were really strong, and I think I have strong boundaries, and I hold true to ethics because I kind of like ethics. But I not only want to see that, but I want to see more massage therapists who kind of connect with something like this, that kind of go, you know what, I've seen a positive benefit in my life because I've touched someone or I've been touched, and I want to do more massage and going into the profession for the right reason. Too many massage therapists go into it because they want to see quick money, or they go into the profession because they're thinking, gosh, I'm going to get all the girls because I'm a massage therapist. None of those are actually the wholehearted reason to get into the massage profession. Ryan, when you got into the massage profession, what was your reason? What was your purpose?
My mom made me. True story.
That was not what I expected for an answer. This is unscripted, guys. FYI, Facebook. This is real.
Because she has fibromyalgia. Yeah.
Your
she has
mother made
fibromyalgia.
you.
Yeah. And then she bugged me for a couple of years to go into the massage profession because she hated paying for massages all the time. So she thought she could get them free if I went through massage school. So
how'd that work out for her?
Well, she got free ones while I was going through school, but it changed after that.
Dang it. Ungrateful children. How dare they?
Yeah.
Well, and truth be said, I've always said this in massage school. For someone who's like, oh, I've massaged my whole life. I'm like, well, great. We're going to destroy your technique. We're going to take you out of anything you know, and we are going to then train you the appropriate terminology and connection so that hopefully by the time you're a year into this, you'll be able to say, oh, I know what I'm doing and why I'm doing it, and be able to explain it so that you actually then can go back to your technique and understand what the benefits were that you were giving people, and hopefully do it better and be able to work with every client instead of just the clients who like what you like. That's one I've always seen massage therapists who just aren't growing, aren't developing, and either you're really tired or you've frozen. Oh, Ryan Hoyme, this sucks. That's a really bad look to freeze on, too. You got a real mopey face.
Oh.
Okay, you're back. Good. The video just had you frozen. So I was like, oh, right. That's not, and now it's frozen on a smile. Hey, that's the way it should be. Awesome. So key things that I wanted to connect on while you're still kind of frozen here is going back to that standard of practice. So when we're looking at the key pieces, oh, Ron, you back? No, you're still kind of aloof. I will talk to my Facebook friends until Ryan gets back, which, hey, Facebook friends, Lamo, laughing my keister off. Thanks, Daniel. My mom made me too. Daniel's mom made him too, Ryan. So you're not the only one out there whose mother forced them to go to massage. Yeah. We need more hospital massage therapists to reduce the pain. Absolutely. Hospital-based massage is an amazing concept that Ryan, how many, you said you've been there for 3 years or 4 years?
2.5 years now at the
2.5,
hospital.
almost 3. So I'm trying to remember how many years ago Obamacare really came in and said, you know what, you have to have surveys and evaluations from your patients that expected that they were feeling a benefit of their service. But those evaluations really opened up a lot of hospitals to massage therapy, and we've been seeing the benefits of that in the profession ever since. Not every hospital has massage therapy, but I can definitely say more hospitals have massage therapy because of an expectation.
Yeah, and I think the big push for more massage therapists that we need in hospitals is just because the whole opioid epidemic that's going on now. So a lot of times the nurses, they don't want to give out opioids and everything else to the patients. So they're recommending massage and other, even aromatherapy. I mean, many years ago, you could not have scents in the hospital, but now it's totally okay. It's just weird.
So are you an aromatherapist?
Yep.
You are? Okay.
Yep.
So how does that's awesome. I hadn't even thought about that, but that's another one that I could see them pulling in. I know acupuncture, they've been trying to connect with. Chiropractic has been a challenge to kind of work into the hospitals because of the whole joint thrust adjustment type thing. Really awesome that they're connecting with all these different aspects to give possibility to clients to feel better other than just, hey, here's a pill.
Yep, and we even have a healing touch practitioner come in for a couple days a week. We even have an acupuncturist that comes in once a week too for the hospital for inpatient. So
nice.
Yeah, and it's a free service too.
So the hospital's just eating your paycheck by making
but they're what hospitals they want to have good feedback. That's the thing. So when they send out the surveys afterwards, so that's the main reason why we're there. So so I also do outpatient. So whenever I'm not doing outpatient, I go upstairs and do inpatient massages. So that's the nice thing about it. So I give maybe 1 or 2 outpatients a day, and then the rest of the time I spend out for inpatient treatments. So
I had a interview at one of our local hospitals several years ago now to go and work at their hospital. They had a full massage therapy department, really great structure, really connected with all the other departments. And when I told them how far away I was from town, I'm pretty sure that was never mind. Because I've got an hour commute back and forth, and they're like, we want someone who's here and available. That, and I was doing all the AMTA stuff and very busy professionally in the other realms of what there is out there. All right, so let's kind of look back at some of these things because I'm pretty sure we've covered a lot of it, but only perform therapeutic treatment in these specific areas. Have you ever heard of any inner ear work?
Sometimes I will perform that a little bit, but I'll just kind of pull it a little bit, more of a myofascial release technique, but I don't go actually in the ear.
Yeah. Everything that I've heard of has been from the auricle, from the ear, the pinna of the ear, being able to
Yep.
pull on the ear and kind of get the fascial pull and tug and kind of get things to move around. External, I've totally understood. But I can't even imagine getting a Q-tip in there to massage the ear canal of someone else.
Yeah, no, yeah.
And I mean, truth be said, I do it to my kids because, I mean, I'm sitting there going, okay, you haven't cleaned this for too many weeks. Let me just get in there and pull this stuff out. But I couldn't imagine having that be part of your paid gig. That's a little more intimate than I'm comfortable with. The intranasal also always makes me giggle because my son does intranasal massage all the time. And I know it's got to be helping him, but I don't know the therapeutic benefit on that side of things. And I like that I have it on the little shrinked up picture, so people are like, what is he doing over there? So yeah, there is a reason for each of these, and you need to have, they don't talk specifically about and be effectively trained in these techniques. Many years ago, there was a big push for prostate massage and kind of the benefits of it and the purpose of it. And there was a doctor who was training massage therapists to do prostate massage. And all of that kind of, to me, felt really icky, but really problematic, because that really opens up a possibility of massage therapy working in the inner anal canal that we don't have the knowledge or understanding. Now, if the doctor wants to train to that knowledge and understanding, that's up to them. But I think the bigger thing is at the end of each one of these statements that says, only if certificant is permitted to do so under state law. So Ryan, what if you're in one of those wonderful states that don't have licensing and they don't have state law regarding
like Minnesota?
Like Minnesota or Wyoming? So how do you categorize this, saying, well, it's not under state law, so I can do it?
I'd say with the whole massage profession, I mean, especially being a male, I just take a lot more precautions, and I just stay away from a lot of those things too. I don't even want to research it. We don't want to know about it. So just to be safe. So
I was just recently, today I called AMTA office, and I was talking to research department, and I had a lot of fun because one of my standard questions is, so as massage therapists, we're about 20% of the profession because 80% of the profession is female, right? And he says, well, last time I looked, I think it was 12% and 88%. And I'm like, wait a second, what? We've shrunk? How could we even shrink? I mean, at 20%, I thought we were at the minimal that we ever could be, but now we're at 12%. So we're more of a novelty act as male massage therapists. And I hadn't thought about us as kind of this niche group, as kind of the odd thing to see. But we really do have something that we draw, and people want male massage therapists. There's a group of people who say, you know what, I'd prefer to have a male massage therapist than a female massage therapist. But then you look at, as you already alluded to, the lawsuits, and not wanting to research something that might be problematic for a massage therapist to really go out and do. I'm always a fan of that sidebar of, you can do anything as a male massage therapist successfully if you first look at the communication, the safe and professional ethics, and the standards that you need to have to make sure that that client knows exactly what you're going to do. if you can meet those things, I think you're going to be fine. But you may still get sued. Sorry, you live in America.
Yeah.
The land of the free, the land of the brave, and the land of the lawsuit.
Yeah. Yeah.
People have the right to accuse you of anything if you did it or not. And so being able to know your boundaries specifically and say, I am following state law, not only by the letter, but also by the spirit, by the concept of what's there, by making sure I'm doing what I think to be right and what probably should be done anyway. Because if anyone doesn't know your intention, you're more likely to have someone accuse you of something inappropriate. And that's a sad note to have to connect with. But you know what? It's truly the piece that makes us, in my mind, makes people want a male massage therapist, is that we have to have quality communication standards so that they can connect with us. Ryan, in any standards that you've set that you think other female massage therapists may not have put out there or as strongly because you are a male?
I would say definitely for even if they've had another massage before, I go over the body beforehand. I explain I massage the arms, the hands, the breast area will always be covered. I explain everything in depth before they get undressed or anything done.
I love the statement, no matter what they've had before. I mean, because they may have gotten a massage before and you have no idea what happened in that session.
Yeah.
So being able to confirm that what your standards are versus what other people's standards are. I think I was in my first year of practice. I had a client come I was at a high-end spa, and a client came in, and she was a nice young lady, and she was talking, and you could tell she was kind of uncomfortable that I was a guy. And I went through my regular spiel of, okay, full body massage includes the head, neck, shoulders, face. We're always going to keep your chest covered. We're always going to have your swimwear area covered. And we'll talk through any areas that you want focus on. And as I continued to talk to her during the session, you could kind of tell she was slowly relaxing. And by the end of the session, when she came out after she got dressed, she says, you know, Nathan, I really do appreciate that you talked to me during the entire session and kind of helped me stay calm, because the last male massage therapist I saw gave me a big hug and a kiss at the end of the session, and it really felt awkward and weird because that's not what I was trying. And I thought maybe I put something out that made him think I was looking to date him, and I was like, oh, no. I am so glad that you decided to come to another male massage therapist to see that that's not what massage therapy is about. Being able to connect that we're professional first and your safety is the utmost importance. Following that Hippocratic oath is so important for massage therapists. And I know several massage therapists who say, I don't even know what the Hippocratic oath is. That's not what I do. That's okay. Understand the concept of first do no harm and the abilities to harm people through communication, through lack of professional standards, through lack of understanding, and through not presenting yourself in a guidance-based technique where people will understand that their best interest is to make sure that they're speaking up for themselves. Empowering your client so that it's a relationship instead of just saying, well, I'm the therapist. I know I've done this 1,000 times. I know what I'm doing here. You can just check out or just grin and bear it. If it hurts, it should. I hate that statement. Ryan, have you ever told a client this should hurt?
When I first started, yes. And even when I first...
I'm guilty. Yeah. But once again, what was it when you first started?
I had the instructors, when I was in school, that's what they taught me to and stuff, and it has to have a lot of pain to get rid of the pain. But honestly, over the years, I've softened a lot. So,
Well, we're moving into a different era of massage therapy. And I think the ability to pull out the concept of toxins that are pooling in your body, and it's got to hurt. It hurt when you did it, so it's got to hurt when we get you out of it. Pulling those things out of massage therapy and starting to stabilize, we're there to assist the body in creating stability and health and well-being. That's a whole different game than when we were in massage school.
mm-hmm.
I don't know how many of my quote scientific classes where they talked about how important it is to do this and how important it is to do that were a story about a guy who had this once happen, and this is what happened, and this was the end result. And no one knew who the person who actually did the research was. It was all anecdotal evidence. And I wouldn't even call it evidence. I'd just call it a story. A great quality fiction in so many cases. We're in this place where if we don't hold to a higher standard, then the profession's not going to go anywhere. We're going to be held down. It's interesting. I just heard again that AMTA is really working towards a clinical direction for massage therapy and connecting more to the medical professional and the medical profession as a whole, and really kind of pushing these positive things in the medical industry for massage therapy. And really the people who are holding us back aren't the leadership in the profession. It's the lack thereof of professional providers. Being able to have massage therapists who come out of school and pass the MBLEX and get into the profession that understand what they're doing is a huge challenge for us. So, speaking of huge challenges, what is your next big thing that you're accomplishing, Ryan?
I just need to finish my degree. That's my only goal right now.
Keep the head down. Keep the fingers at the books. You got this. Awesome. And do you have a estimated date and month? Year, month?
August 2019. So.
Okay, I'm putting it on my calendar.
Yeah.
I'm going to give you kudos and props. August 2019. Anything you're going out and doing? Any events? Any connections that you have?
I'm kind of scaling back on all those just because I'm so busy with my other jobs. But I'm probably going to be going to the World Massage Championship in Denmark again in June. So.
I still want to. I still haven't been able to look at my books to see if those dates work. But oh my gosh, that would be so much fun. So when you're there, are you the odd American?
No. And the thing is, so many people speak the native tongue over there to me because they say I look like them. But virtually everybody I talk to, they'll speak their native tongue to me, but then they'll figure out that I'm American, so they'll speak English. So
it's the bald head.
Yeah.
You don't have a hairdo like an American, so it's obviously you're not an American. Awesome. And so when you go to these things, and if you could just quickly refresh me, so there is a World Massage competition, and have you been a judge? Have you participated, or just went to watch?
Yeah, they've had it for 2 years now, and I've been a judge both of those times.
Okay.
So be a judge again then. So, and now they're offshooting to other countries around there now too. So the main one is in Denmark, but they're having European one, Italy one, a London one, a Russian one now. So
you then have to qualify for the world competition?
Nope. The thing is, it's eventually going to come out to that, just because it's going to get a lot more popular. But it was in its infancy. But I can definitely see it going that way. So right now, you pay an entrance fee, and then you're entered into it then. So this year, we had, I think it was 160 or 170 people participate. So
wow. And nothing in the U.S.?
No, nothing yet, but they're talking about coming over here too. So
all right. Well, keep me updated on that. And if you need any connections or communication, I'm more than willing to vie for this. I think that's such a great perception and change and really development of kind of connecting. I just have one more question about it. Can you give us any ins on what the judges are looking for in these types of competitions? Because I don't know how you would judge that.
I mean, sometimes people try too hard to all these different kind of techniques and everything else. But if you're not fluid at it, I mean, you failed right then and there. So
yeah, lacking fluidity, that's definitely a challenge.
That's the biggest thing. So even somebody that does a basic Swedish massage, if they're really fluid and nice flow and everything else, they're going to get better ranking than somebody that's really cool techniques, but just all over the place, you know.
All right. Well, having that being said, if you happen to go and visit, go ahead.
But one more thing about that too, it's some people complain that massage, it's not a sport, but the way I look at it, it's a great way to see people from all over the world. I mean, last time there's over 30 different countries that were representing there. Wow. So I learned so much. I made so many new friends, and I'm still friends with a lot of them on Facebook too. So it's just amazing.
Well, and for me, going to an AMTA national convention, you get to connect and really kind of enjoy and understand and learn a lot from other massage therapists, but you don't usually get an opportunity to really grasp the hands-on aspect like that. You go and you take a CE class and you learn something from the instructor, but I usually learn more stuff from the other massage therapists that I worked with in the class, because they all have some other technique. They're like, oh, yeah, I do this. Well, I do it this way. And you're like, oh, yeah, that makes sense. I could definitely do that as well. So this, in my mind, is an easy go-to of, hey, you know what? We're all here. Let's see what they do that's special. Let's see what they do that's special. Let's see how this works, how that works. That's, in my mind, just such a great connection. So all that being said, if you go to Denmark with Ryan, please make sure to say hello. If I am there, I will definitely be podcasting it and doing all of this, because there's no way I couldn't. I mean, I would have to really create this event that just kind of opens up the possibility of what people are seeing and all that kind of stuff. It's just so exciting to me. So, Ryan, once again, thank you so much for joining me. I really do appreciate you putting yourself out there, especially when you've already worked for a long time today. I appreciate your love for the profession. Love the new book. Thank you for putting it out there. I'm actually doing some connection with the Cortiva schools and talking to them about really kind of how to draw in massage therapists. And this is one of those tools that I will be connecting with and kind of seeing who all's reaching out.
Awesome. Thank you very much, man.
No problem. If you have any questions about massage therapy, you can hit Massage Nerd. Is massagenerd.com still open and up?
Yeah. Yep.
Okay, massagenerd.com. Go to YouTube and just type in Massage Nerd. You're going to have years worth of information to watch. He's known because of A, his laugh, B, his videos, and C, his straight bald head. So we appreciate, I know, right there.
Somebody said, doing the nerd.
As long as it's not on a shirt, you're good.
Yep. Well, I did it once, but I changed that really quick. So
yes, you did.
I put him up and sideways instead. So
yeah, he's got to be a little cockeyed or kind of on the back. On the back. Yep. Awesome. Well, Ryan, it was a great enjoyment. Enjoy yourself. Have a great night, and I will talk to all you Facebookers again soon. Thanks for joining us. We will talk to you again soon. Bye.
Okay, thanks.
Ryan.
It was nice to meet you, Ryan. Thank you, Nathan. The hour has flown by. We hope you've enjoyed this discussion with Ethics Outside the Box. As you've seen, Nathan uses many second-hand stories of ethical situations. If you'd like to share your story or you have any questions, feel free to contact him and Nathan at educatedtouch.com. If you'd like to register for next week's live webinar, go to shop.educatedtouch.com. Under live webinars, you will see all upcoming webinars. If you have just watched this video and would like continuing education for home study, you can go to shop.educatedtouch.com under the home study options with the date or episode number to receive your exam. If you would please like this video and subscribe to our YouTube channel, we will keep you up to date on new videos. If you'd like to attend one of our live courses, you can find upcoming scheduled events at www.educatedtouch.com. Thank you for joining us today. Be well and have an ethical day.